of infectious diseases. Okay, class, can you now view? Can you now view my current slide?
Yes, ma'am.
Yes.
Yes, ma'am.
Okay, so we are now on the, like what I've said, we are now on the second chapter or the second topic for the midterms, which is diagnosis of infectious diseases. So for this topic, we are emphasizing more on the clinical specimen, how you as future nurses in the future or others will be in the clinics or hospital or in the research agencies, you need to know how the proper collection of the clinical specimens, how to handle it, how to manage, and to follow protocols and guidelines on how to prepare, okay, and to collect samples of the clinical specimens. So we are talking of the clinical specimens like the blood, stool, cerebrospinal fluid, okay, urine, wound, or the pus, okay, so or and the gonococcal specimen, okay. So how will you be able to manage to handle and collect this specimen from your patient or your client? So we are to, of course, know the different requirements of the diagnosis of the infectious diseases. So first, you need to know the complete patient history. So upon admission in the emergency room, so this is now we consider it as nosocomial infections. So when you say nosocomial infections, these are the infections that usually are common in the hospital that the patient acquired aside from the existing infection or the disease. Okay, so upon admission, they need to get your complete patient history. Okay, so they will be asking of your previous sickness or your previous infection or previous diseases, and if you are taking medications for maintenance. Okay, so they are actually parang sort of interviewing the patient or the client. Okay, and after that they will need to examine you physically. Okay, so physically they need to get your weight. Okay, and sometimes they will get you or get your height or your what do you call this, if you have fever, your temperature, your vital statistics, your heart rate. So they will need to examine you physically. And for the signs and symptoms, they will be asking you what has caused you to go to the hospital or to be admitted. What are the signs and symptoms? Of course, they will be asking you if you have, how many days have you been experiencing the fever, or have you vomit, or have you experienced nausea or headaches or whatever. So they will be asking you what's the problem that you felt. Okay. Or the signs and symptoms. Okay, and then fourth will be proper selection, collection, transport, processing of clinical specimen that should be done in the hospital or in the clinic or in the laboratory. Okay, so proper diagnosis using clinical specimen, we term it the diagnostic test. This is the tool that provides information about the client. So hindi pwedeng basta ka na lang pupunta dun sa private room nyo. You need to follow step-by-step process. If you've been admitted, they will be asking you if you have Medicare, field health, or whatever. And then emergency room, they will be getting all your blood, your urine, or your bodily fluids that needs to be analyzed, needs to be examined, and by that time it's they already taken your all the information. That's the only time that you will be going to your room. And in your room, they will monitor your progress and improvement of your illness. Okay? So the clinical specimen that we are talking to here, these are the various types of specimens that are collected from patients and used to diagnose or follow up progress of infectious disease. So when they, even if they are not sure what's your infection, what's really is your sickness or your disease, it is a protocol that they need to get your blood test and urine test. This is the common. But if you are not experiencing diarrhea, they are not to get your stool, or they will not analyze your stool. Okay. So these are common protocols and guidelines in the hospital. Okay. So for the purpose of this diagnostic test is of course basic screening. So in the basic screening, they will not conclude they will not of course confirm yet your sickness or infection or the disease. Okay? And then next, after basic screening, they would need to confirm your diagnosis through the result from the laboratory or from the result of the clinical specimen that they got from you. Okay? And then third purpose will be monitoring of the illness. If you have progress, if you after 1 day or 2 days already been the symptoms lessen, okay, 1 or 2 symptoms already gone, okay, so they are monitoring your progress. Okay, and then fourth will be client's response to treatment. So in the client's response to treatment, if the antibiotic prior to the confirmation of your diagnosis, they will actually first give you a general medication that might help you to let your symptoms or signs to subside. Okay, but the moment they will confirm it, they may continue the medication that they give you at first, but the moment they will confirm it, that's probably not directly that's your infection or sickness, they may change it to the specific antibiotic or treatment. Okay, and they need to know your if you have good response or a positive response to treatment. So these are the purpose of the diagnostic test. So for the responsibility, may it be the nurse in charge or may it be the healthcare professionals, it is also in one way or another be the responsibility of the family members. Okay, but for this, the nurse or the healthcare professional should teach client and family how to prepare for the test. So in this responsibility of the nurse or the healthcare professionals, may it be the doctor or the medtech, okay, they need to teach the client how to prepare the test. Like for example, if they will be informing the family if the test that they will be having or be performing to the patient will be expensive, or they will be preparing the patient if they needs to. Okay, what to do and what not to do. Okay, so this is actually one of their responsibility. Another responsibility of the nurse and the healthcare professionals would be they need to teach care following the test. So what are the protocols after performing the procedures or the test to the patient? What needs to do following the test or the procedure? Okay, and then provide most appropriate nursing intervention. So this one is, I think, even if you are not been taught of to provide the intervention, nursing intervention, at least as your care to your fellow men, you are to intervene. Okay? Yung kumbaga, you are giving advices. If you have experience before, you have to give advices, or even if it's not a moral advices, you can also give advices like if you know where and how they will be able to get financial assistance from the government agencies, you need to also share so that they will be able to of course avail or apply for those financial aids or financial assistance. Okay? So for the diagnostic test, okay, there are actually 3 phases. So the first phase of the diagnostic phase is the pre-test. Okay? So when you say pre-test, from the word pre-test, okay, this now comes the main focus of this phase is the nurse. It is the nurse responsibility to do assessment of the patient. Okay, and of course provide what you call this, if there are requirements for equipment and the materials needed prior to the procedure or the test, it needs to be prepared. Okay, if there are needs that needs consent from the family, they need to prepare in this phase. Okay, so this is the phase where prior to the procedure, there are preparations of the equipments, preparation of the client on or to answer all the questions that will be asked from the family and or from the patient. Okay, so that's the pre-test. Next would be intra-test. So in the intra-test, this is now where the main focus of this phase is the nurse responsibility is to collect, okay, okay, and then or transport the specimen, okay, the collection of the specimen or the clinical specimen, okay. So this is now the phase where the procedure will be performed on the patient. Okay. The third phase would be the post-test. So after the procedure, okay, the post-test would be the main focus is to compare the previous result, okay, previous result from the current or the present result of the test. Okay, so in the test that the test would be depend on the patient's sickness or infection. So usually, if you are to collect blood 3 times a day or every 8 hours from the patient, okay, they need to monitor the progress, okay, from the previous how many, okay, so they will need to compare the result of the platelet or the WBC or the RBC. Okay, so these are the following phases of the diagnostic test. Okay, so for the types of clinical specimen to diagnose infectious diseases, first we have the blood. So what are the protocols when you are in the hospital later as a nurses? Okay, so what are your responsibility that you need to master? Okay, and to follow guidelines and protocols. Okay, so it's not only the medical technologies that are involved in of course, in the handling of this, but when you are in the area or in the room of the patient and you are asked to get the specimen, you need to know what are the protocols. Okay, so blood is usually sterile. Okay, but the moment if you are infected with you have infection in the blood, okay, or the bacteremia, that may indicate a disease, although a transient bacteremia may occur. Okay, so usually this is common after delivery, okay, or sepsis. They term it sepsis, infection of the blood that the baby may get it from the parent, okay, or the infection may be brought about by the condition of the mother, okay, so it can be in that case. Okay, so the septicemia is a serious disease characterized by chills. Okay, so chills, fever, okay, prostration. So when you say prostration, this is the general weakness of the body. Yung parang nanlalata ka, nanghihina ka, you felt very tired already. Okay, and the presence of bacteria or their toxins in the bloodstream. Okay, so this is the most severe type of septicemia are those caused by gram-negative bacilli, those rod-shaped microorganisms. Okay, so like Bacillus subtilis. Okay, so how is septicemia diagnosed? So you need to at least they need to culture your blood during 24-hour period. So when you say 24-hour period and they need to collect it 3 times, so every after 8 hours, okay, they needs to get your or extract blood from you. So that the moment you start to take the medication or start having the treatment, they needs to know the progress, okay? Or they needs to confirm if it's still your blood that's been has been infected with the bacteria or the microorganism. So septicemia is usually diagnosed at least 3 blood cultures during a 24-hour period. Okay, so guidelines in collecting the blood will be the following. Person drawing blood, okay, should wear sterile gloves and gloves must be changed between patients. So may I ask everyone to open your camera? I forgot it. So every now and then, if you will be having lecture discussion or not only in the exam, you need to open your camera because in like what I've said last time in one of our meetings, they need to, if they will be opening our recordings, they need to also see how participative are the students, or are they listening, or they are just while opening their teams or their camera, they are doing something. So they are needs to see your your presence in the recordings. Okay. Another guidelines in collecting blood will be when disinfecting the site, use a concentric swabbing motion. So when you say concentric, it should be in circular motion. Okay. So allow iodophor to dry, apply tourniquet, and withdraw blood. So the antiseptic that is usually common in the hospital, aside from the 70% antiseptic, the 70% isopropyl or the ethyl alcohol will be iodophor or the povidone iodide. Okay, and then they will be using tourniquet. The tourniquet is actually like a rubber, big rubber band. Okay, it's a rubber band. Okay, that usually used to in cases of emergency, in cases of there are a lot of uses of the tourniquet aside from it is also used in the extraction of blood to see your veins to get or to withdraw the blood. But aside from this, when they extract blood from you, it is also used when in times of accidents and the moment you are been what do you call this? Kumbaga naputulan ng kamay o nadisgrasya, they need to use the tourniquet to prevent the blood flow of the blood, yung parang maubusan ka ng dugo. Okay, so these are the guidelines in collecting blood. Okay, so traditionally blood is injected into the 2 blood culture bottles. Okay, so always disinfect the rubber tops and transport properly to the laboratory for incubation at 37 degrees Celsius. Okay, so you need to follow and remember these protocols in the collection of the blood, and how will you manage to preserve it, or how will you be able to cultivate or to be able to culture it. Okay, so blood bottles should never be refrigerated. So you need to remember for the clinical specimen, which are to be refrigerated and which are not. Okay, so you will be able to learn from the succeeding slide which of the clinical specimen are not to be refrigerated. Okay, so these are types of blood bottles. Okay, so we have the tourniquet here. Okay, and of course you need the syringe to extract the blood. Okay, and then after puncturing, you need to cover the puncture site with the micropore. Okay, so we have these different types of blood according to their color codes. Okay, so hindi basta-basta nilalagay. There are corresponding uses or usage of this color blood bottle, colored blood bottles. Okay, so they have specifications. Okay, so for the lavender or purple, it contains an anticoagulant or the EDTA or the ethylene diamine tetraacetic acid. It has the EDTA that used to not to what you coagulate the blood. Okay, this is used for whole blood specimen. If you are to be examined for your blood type, or this is used for CBC. Okay, and of course blood typing. For the red, it contains a clot activator. Okay, used when serum is needed. Okay, so yellow contains the thrombin for stat serum testing. Okay, so it has a specific usage of the different color of the blood bottles. For the green, it contains heparin, used for blood chemistries or for the electrolytes. So when you needs to be examined, your blood, whole, lahat, for your glucose, etc. I think in the hospital, this worth 2,500 to 3,000 para malaman mo lahat if you are you don't have any problem with your glucose and then in your electrolytes, every component of your blood. Okay, for the blue, it contains citrate used for coagulation studies. So this is usually used for research. Okay, that with regards when they uses blood as part of their research. Okay, so for the next type of clinical specimen, the second would be urine. So the urine, this is ordinarily sterile, okay, but becomes contaminated in the distal urethra. So in the after food, water, you will be analyzing or you will be learning in the video presentation the microbiological examination of the urine. So you will be able to learn of what particular stream samples are occupied or had a greater number of microorganism or bacteria. Is it from the initial stream or the midstream? When you say initial stream, this is yung the first flash of the urine, and at the middle would be the midstream. So which of the two streams will be greater, has greater number of growth of microorganism or the bacteria. Okay, so usually urine is been collected using this bag here. Okay, so we have here the Foley catheter used in the performing catheterization. So the healthcare professional or the nurses should be the ones be trained, okay, and mastered the process of course, what do you call this? Inserting it to the patient, etc. Okay, so that's one of the collection of the how to collect the urine. Okay, another will be from aspiring from using the syringe. Okay, so kung hindi na makaihi yung, if the patient already have chronic kidney failure, they needs to collect it from using the syringe. Of course, the one used performing this one is trained enough to know what part to inject the syringe. Master, who already mastered how to works the part where they will be inserting the syringe. Okay, so this we call it the needle aspiration of the urine. Okay, so urine should be analyzed within 30 minutes or refrigerated at 4 degrees Celsius for 24 hours. Okay, so if it's not been examined ASAP or directly upon receiving it, you can refrigerate it at 4 degrees Celsius for 24 hours. Okay, but if it will not be refrigerated, it should be within 30 minutes only. So there are three parts of urine culture. We have the colony count, okay? So when in the performance of the experiment later, okay, you will be using the S pattern, okay? You are to get the loop full of the sample and you just have to streak it as S pattern, and after that you will need to incubate it. After that, you are to count the colonies, okay? After incubation and counting of colonies, you are to isolate, get a sample, okay, and then perform the gram staining procedure for the identification of the microorganism or the bacteria. This is a confirmatory performance or analysis. Okay. After that, you can also perform antimicrobial susceptibility. Okay. So you can test different antibiotics where they can be effective to kill or prevent growth of the microorganism. Okay, so these are the three parts of the urine culture. So in the urine, we usually use the calibrated loop. So how is it different from inoculating loop? Okay, so the inoculating loop, we may say that it's not that accurate, though they have, of course, they have this loop, or in one way or another, they cannot be as accurate as the calibrated loop. From the word calibrated loop, they are already sterile. So we usually purchase it, and they are UV sterilized, okay, and they are plastic. So you can dispose it every after use. So there are three types of calibrated loop. We have 0.01 ml. Okay, so for the 0.01 ml, the dilution factor will be 100. So you will be multiplying if after the incubation and you have, let's say you have 37 or 31 colonies, you just have to multiply it by 100. That would be the number of bacteria that's present in that particular that particular what do you call this dilution. Okay, and then we have the second type would be 0.001 ml, and the dilution factor will be 1000. I think this one 0.001 ml is the one available in the lab, and this is the one that we use in the performance of the experiment. Okay, so incubated urine for incubate the urine for 24 hours at 37 degrees Celsius. Okay, so for the colony forming units or the CFU, this will be equal or about 100,000 is you are suspected to have urinary tract infection. Okay. So you need to multiply the number of colonies times the dilution factor to get the colony forming units. Okay. Third would be the cerebrospinal fluid. So when you say cerebrospinal fluid, I think this is the most expensive or very delicate collection of the clinical specimen, because it has something to do with your nervous system, which comprises your brain and of course your spinal cord. Okay, so these are the diseases which been diagnosed using CSF or the cerebrospinal fluid. We have, of course, meningitis. This is the inflammation of your meninges of the brain. Okay, and then we have the encephalitis. This is the inflammation of the brain itself. And then we have the meningoencephalitis, okay, both inflammation of the meninges of the brain and the brain itself. Okay? So how to collect the cerebrospinal fluid? Okay? So this is the image where you will imagine how this clinical specimen should be collected. So the healthcare professional should be trained. So specifically, the doctors, okay, are trained, or if there are nurses, head nurses that are trained to collect this type of clinical specimen, they needs to master how to collect this. So how to diagnose or to collect this cerebrospinal fluid, they needs to let the patient lie down in this position, okay, with of course the lab gown, okay, and then the cerebrospinal fluid should be collected at the fourth lumbar vertebra. So we have this your cervical here. Okay, it's not in the cervical, it's not in the thoracic, but in the lumbar. Okay, so in the lumbar, it is in the fourth lumbar vertebra. Okay, so they need to master where is the fourth lumbar vertebra. So they are trained already how to perform this. Okay, so the moment you are to improperly perform this, they may affect the patient. So they needs to be trained. So the injection site is actually after, okay, the bone of the lumbar, fourth lumbar vertebra. Okay, so the syringe is used here, okay, and they usually inject it at the or in between the fourth, okay, but they usually emphasize it at the fourth lumbar vertebra. Okay, so this is now the procedure. Okay, so you can just imagine if you are not trained enough, okay, to where to inject, okay, the syringe, you will not be able, or you can of course cause any you can cause additional problem to the patient. Okay, so they needs to know where is the fourth lumbar vertebra. Okay, so this is now the collection tube. Okay, that they needs to directly after collection, they needs to pour it in the tube. Okay, so that's the cerebrospinal fluid. So collection, okay, rush to the lab, do not refrigerate, okay, and they will perform gram staining for the presence of any bacteria or the microorganism or the or any microorganism that may infect your in this clinical specimen, and then they will do preliminary report. So this is how to diagnose and collect cerebrospinal fluid. Okay. Fourth would be sputum. So the sputum is usually, we call it the pus that pus or the pus, okay, that accumulates deep within the lungs of a patient with pneumonia, okay, caused by Klebsiella pneumoniae, or the tuberculosis or the TB caused by Mycobacterium tuberculosis or other lower respiratory infection. So if the patient cannot cough it violently, and they cannot get any pus within, and it will not be will come out directly from the lungs, okay, they needs to have an alternative. Okay, so proper mouth hygiene is required. Okay, and then if TB is suspected, extreme care must be observed. Okay, so if TB is suspected, you are not to use any ordinary face mask. You are to use the N95 face mask. Okay, if TB is suspected. So there are alternative. Okay, if you cannot cough it violently, and the pus or the phlegm will not come out directly from your lungs, okay, you have the alternative. We have what we call it the bronchoscopy or the bronchial aspiration. So the bronchial aspiration, or they are using the bronchoscope, okay, this is a thin lighted tube, or it has a camera inside where they will be able to see, okay, from the screen, computerized screen, the what's inside your respiratory system. And from there, they will be able to aspirate a pus or a phlegm, and that would be their needs to analyze and examine as your clinical specimen. Okay, so we have the bronchial aspiration and true bronchoscopy or transtracheal aspiration. Okay, if you cannot cough it violently. Okay, next would be the throat swab. So this is collected to determine if a patient has strep throat. Okay? So for the throat swab, you need a tongue depressor. You know a tongue depressor, yung mas malaking popsicle. Okay? Di ba, if you experience that, and you are suspected to have parang tonsillitis or any inflammation, in your tonsils, okay, the doctor will let you see your tonsils or inflamed, or your pharynx, okay. So they will take the swab from the packet and rub the swab, okay, from the tonsils and or the posterior pharynx, and insert the swab back into the packet and transport it. So this is now the wooden tongue depressor para maibaba nung doktor yung dila mo, and he will be able to see your tonsils and of course the what you call this, your pharynx, if there are inflamed or kumbaga rashes within, okay. And then we have the swab. So the swab, you have of course type of swab, okay, for the gonococcal culture, okay. That is the throat swab, but for the gonococcal culture, we are to use the different type of swab. We have the Dacron swab. The Dacron swab is usually, it is actually the brand name of the polyester swab, okay, from the fibers or the polymers, okay. And then we have the calcium alginate swab. This is actually from algae or the seaweeds, okay. It is from the combination or the mixture of salts of alginic acid, okay. And then we have the non-toxic cotton swab from common in our laboratory in the university, okay. So the gonococcal culture, if you cannot imagine yet, this is the part in the female's reproductive tract. Okay, they usually insert this equipment. Okay, so this equipment is not it's not only used when they will swabs and get something from the respiratory tract. Okay, but it is also used when they perform the transvaginal ultrasound para they will be able to insert the camera or the tube that we will see what's really the problem within or inside your reproductive system. Kaya mas mahal. It is very much expensive when they perform or you will take the transvaginal ultrasound. Compared it from the belly or the common ultrasound. Okay? Na lalagyan lang ng jelly, and then they will be examine already what's happening or what's inside. Okay, so that's for the gonococcal culture. Okay, so the culture for the gonococcal will be inoculate in a tire, okay, or a tire Martin or Martin Lewis medium, and incubate in the carbon dioxide environment. So take note of this requirement when you are to culture the gonococcal infection, okay? And then for the alternative, you can use tube or bottle with appropriate medium in an atmosphere of 5 to 10% carbon dioxide, okay? So cultures for the gonococcal must be incubated at 37 degrees Celsius overnight. So basically, from the blood, urine, okay, usually can incubate at 37 degrees for 24 hours. Okay, so never refrigerate gonococcal swab. Okay. Next would be the wound specimen. So the wound specimen, they usually needs to aspirate it rather than swab. Because when they aspirate, they will get directly what's in the wound rather just to swab it. Okay, they might not get everything from the wound. Okay, so for the wound, they needs to get an information, okay, on the request slip, like the type of the wound, okay, and where is the location or the anatomical site, okay, kung saan ba yung parte ang may sugat, okay. And then I think this is the last for the fecal specimen. You need to keep specimen warm, okay, with a pH of 7 for the fecal specimen. Okay, so that's it for the clinical specimen. So I decided to have your quiz as one because this part of the concept of the midterm is just brief. Okay, compared with the next lecture concept that would be preventing spread of infectious diseases, we will be having 100 plus slide for the next topic or the next concept. Okay, so for next week, you need to prepare, okay, or to review, okay, both the microbial pathogenicity and epidemiology and this diagnosis of infectious diseases. Okay? So, konti lang naman itong specimen for the clinical specimen. You just have to master and to know the protocols and guidelines, how to collect, how to diagnose, okay? Or what are specimens that needs to be refrigerated and what are not to be refrigerated. Okay? So, any question, class, regarding the diagnosis of infectious diseases before I will assign your post-lecture activity? Any question about the clinical specimen? Any question before I will assign your post-lecture activity? So, may I just announce it, okay? On the midterm, we will, we have feedbacks actually that we have received from our other classes, okay? I think in some way or another, it might be one of your feedbacks, but you cannot actually say it, but this is our tentative. May I just announce it to the class, okay? For our midterm OSPE, both that covers the lecture and the laboratory, we will just be giving you one station, okay, per student, and you will be given different set of questions per station. Actually, I've done this in my biochemistry class. Ginawa ko siya because in the experience that we had before, okay, we have the whole day. You are there waiting for your turn to be admitted. So what we actually considered, one of the suggestion of my student in my 1F, that in the next midterm OSPE, we will be giving you your schedules for the ones taking the OSPE in the morning and the others will be taking their OSPE in the afternoon, so that you will not be anymore be waiting the whole day. You just have to join it. If your schedule is in the afternoon, you are to join only at 1 o'clock. You are free in the morning and you are to join only at 1 o'clock. Okay? So that's one of our considerations that we got it from the feedbacks from one of our classes. It might be one of your feedbacks too, but you can, of course, you cannot raise it para medyo makagaan-gaan sa ating lahat. I know if you are tired or also waiting in the lobby, we are so much also tired because we started at 8 o'clock and we just end it basically at 6 o'clock or more than that. Okay? So sobra siyang nakakapagod. So though we are tired, but I think we felt fulfilled with the experience because this is actually the one that we need to do to assess students from their learnings from lecture and the laboratory. So that's some of the changes in the OSPE for the midterm and finals. But if you still have things in mind that you need to raise or you need to that we need to consider it, you just have to raise it or you just have to tell us so that we can consider it, and we will be considering it on our next midterm and of course final exam. Gagawin natin kung it would be possible to do it. Okay? Para medyo makagaan-gaan lahat sa atin. So, of course, the preparation in the question of the stations are very difficult. So that's why in one station, okay, ang ginawa nga namin sa biochemistry, for one station, there would be 2 students that will be taking that particular station. Okay, like for example, station 1 will when I will be admitting the first student, and he would need to take the first station. Okay, the next would be the same. Kasi pag the moment the first student who took the station 1 already left the meeting and I will be admitting the second, of course, he will not be able to share it to the next. Did you get my my point? Hindi naman niya ma-share yung station, the questions from the station to the next the moment I will already admit the second student. So maybe in the midterm OSPE, we will be preparing one station question good for 2 students. Kasi napakahirap din mag-prepare ng questions that are so different from the stations that you already been prepared. So expect that you will be having different questions for the midterm and the final OSPE. So that's why I will be asking all your laboratory instructors, although pareho kami ng coverage. So for the station, you will be, if we will have 5 concept or more chapters in the lecture, one station will be about the epidemiology, second station about the epidemiology, okay, and then second would be about the diagnosis of infectious diseases, third would be preventing spread of infectious diseases, fourth would be human defenses, fifth would be infectious diseases, and the others would be part of the lab. Okay, maybe the sixth question will be the microbiological examination of food. So it will be distributed. So kukuha kami na tig-isa. So for each of us, we will be preparing, okay? So if we have students like 40, if you have both lecture and lab, you will be preparing 20. If you have 34, 22 sets of different stations per different questions per station. So, ganun ang gagawin namin. So that in one station, you are to finish the different question good for maybe 20 to 30 points already, the station. And you are to answer that for 5 minutes or 6 or 8. So it will depend on the points on the questions later. Okay? So that is our tentative plan. And hopefully we will fulfill it the moment we will be able to execute the midterm OSPE. Okay? So if you have feedbacks, okay, you can raise it in your laboratory. If you wanted to raise it in your laboratory instructors to Ma'am Bongot and Sir Jeff, you may do it, or you may talk to them if you will not be able to tell in the class today, okay? So that we will consider all your feedbacks, your suggestions, your comments, okay? So that we know how to improve it, okay? So that we will know how to change it for the better, okay? So any questions still? If you want, if you have something in mind that you need to raise. So, do you have any question regarding the discussion for tonight before I will assign your post-lecture activity to be submitted siguro 8 o'clock na lang, so that there will be no more extension of the submission. Any question regarding the diagnosis of infectious diseases? So, for the quiz and the exams, for the midterm exam, you need to know what are the protocols in handling the clinical specimens. Yun lang for the diagnosis of infectious diseases. Okay? So, wala nang question. Okay? So, are you ready for the closing prayer, anak? Sino yung nag-lead sa atin kanina? Can we have the closing prayer? Is it Miss Bongi? Miss Bongi pa kayong kaninang nag-lead ng prayer? Is it Miss Bongi? Or can we have the closing prayer before I will assign your post-lecture activity? Wala? Nawala si Miss Bongi? Who is the one who lead the prayer a while ago?
Ma'am, see you.
Sino?
See you, sir, ma'am.
Wala siya dito? Okay, who will volunteer to have the closing prayer tonight? Anyone? Who will volunteer to have the closing prayer, to lead the closing prayer? Nawala yung ating prayer leader. Okay, anak Miss Zaira. Okay, Miss Yabis, can you now lead the prayer, anak?
Let us pray. Name of the Father, and of the Holy Spirit. Amen. Glory be to the Father, to the Son, and to the Holy Spirit, as it was in the beginning,
Is now,
now, and
and
forever.
forever. Amen. In the Father, Son, the Holy Spirit. Amen. Okay, thank you, anak, Zaira. Thank you, class, for attending. I hope you learned something from our discussion this evening. Okay, I'll see you next week for your long quiz. I hope and I pray that you I will be monitoring your progress. Okay, I hope everybody will pass and we'll be able to meet your 85% cutting grade for the prelim. But as of the moment, we cannot give you your prelim grade because we cannot get your scores from our iTransform because we cannot open it until today. Okay? But you are to make it again for this midterm by starting to have high quizzes and submit all your post-lecture and post-laboratory activities. Okay? So thank you, thank you. Stay safe and healthy. I wish to see you next week for the quiz. Okay? Thank you, bye-bye. You can now leave the meeting. Thank you. Okay, bye-bye. Thank you. Sige.
Thank you po, ma'am.
Okay, bye-bye. Thank you. I will
Bye,
now
ma'am. Thank you
assign
po.
your task. Okay, bye-bye.